Okay, here you have Jan, and she came to us about a month ago, and she literally had chronic pain from her neck all the way down to her lower spine, both her knees, and a lot of degenerative arthritis. And how long have you had these chronic pains for?
About 20 years.
Yeah. And what treatments have you tried in the past?
Pretty much everything that you could, that's out there.
Yeah, pain pills, cortisone.
I had cortisone, I've had the PRP at the Mayo Clinic, I've had every kind of pain medication. I've gone to places, physio, a lot of physio.
Acupuncture, chiropractic.
Yeah. I can't name them all. Whatever is out there.
You've tried everything, yeah.
So if you say, have you done this? And I say, no, I'll be doing it.
Have you told you needed surgery anywhere?
Yes, I was supposed to have surgery about 10 years ago, and our orthopedic nurse, she looked at me and she said, I think you're moving too well, you're too young. She said, just wait.
And was that the replacement or spinal fusion they wanted to do? Okay, yeah.
And I was so happy.
Yeah, so the knees were bone on bone. So last month we decided to do the laser stem cell procedure. And how are you feeling now from head to toe?
I feel like honest to God, I feel like somebody's giving me a drug that's making it better.
Yeah.
Because, I'm cautiously optimistic, but every day I'm thinking, is this happening? Is this happening?
Yeah.
But people like my friends and my family are looking at me and saying, what the hell? Because I'm moving.
Yeah.
And I'm moving quickly.
Uh-huh.
And like
before you're hobbling around, you hobbled in here.
Oh, but the first day I came, Christ.
And you weren't smiling, you were like this, and now you're like,
oh, no.
Yeah, energetic, smiling, look 20 years younger. You noticed her too?
Oh, yeah.
After the procedure?
She and I went to a grocery store quite a while ago in Palm Springs, I think it was. And I couldn't, about 5 minutes, I had to literally find something to sit down.
Yeah.
And we'd go maybe 5 minutes, I think it was.
Oh, yeah.
And then that was it.
How far could you walk now?
Oh.
All day?
Well, I was in Phoenix and I went shopping and a couple other things, and I was on my feet
even through the airport.
Went to the airport.
We used to have to get a wheelchair to get her through.
Yeah, Sky Harbor Airport is horrible. You gotta it takes forever to get to your Uber. Yeah.
And so I was on my feet, standing or walking for about 4 hours.
Yeah.
And I kept thinking, what the hell is different?
And your knees held up and your back.
And I'm kind of pushing them, thinking, getting in and out of the car and getting up, it still hurts.
Yeah.
But I also know that doing, I don't know if I mentioned it too, but doing the Pilates, which I do twice a week.
Now you can do the Pilates, your spine is strong enough.
I was doing it before, but I go out of there so sore. But now, I'm kind of excited to get back, because I've been gone for 2 weeks again. But
and neck and back improved as well.
Neck I can now shoulder check. Before I couldn't.
Oh yeah, you couldn't twist your neck.
I just take my chances and hope that there's no car coming. Right. But I can turn my neck. I can do this. I can. I used to laugh at people that gave these testimonials.
Yeah. But now you understand. Yeah, they're real.
I have to, and I just take it a day at a time, like I do everything else.
Okay.
But what I will say is what you recommend to do every day with your diet, with your stretching, with
the home light. Yeah.
Home light. If you don't do it, it's not going to work.
Exactly. Yeah. It's like we're growing a plant. The stems are the seeds. We planted them in your joints.
You called it a fireman before, and they were going for the.
Yeah, they're both right. And then the plant seeds are the peptides, or the fertilizer. The sunlight is the home light, and the laser you get here.
But I really also the stem cell support diet I followed that. Of course, I do everything like that.
The anti-inflammatory.
I followed that. I was home for 2 weeks, and that's all I ate.
That's good.
And now I'm into that habit. I'm kind of bugging.
Don't you notice you have more energy now?
Oh my God!
You don't get that lethargy after the carbs.
Like I talk fast as it is, but now I'm really like a bloody machine gun.
Oh yeah, it gives you brain energy. The good fats,
And I'm sleeping. It's just. I was thinking here, what can I say that maybe isn't working?
Well, plus you had the the IV, the anti-aging wellness that helps too.
I thought about that.
Yeah, that helps too. Yeah. Let's see how you're walking. Only get up from the chair.
See, look at this real quick.
Look, you don't have to use your hands to push the chair up, and look at you. Yeah. So how many percent better do you feel overall 1 month later?
How do I feel overall?
Yeah.
Percentage-wise.
Percentage-wise? Oh, I would say, 60%.
Well, so that's 10 years of chronic pain, or was it 20?
20. And the last 2 years have been just unreal.
60% erased in 1 month. That's pretty remarkable.
Yes. And I'm 70.
Yeah.
And it really started to kick in when I turned 65.
Okay, yeah.
And then it just went, and then my neck started, and everything just, and I just gave up, basically. And I was
Well,
just
we're going to give you a little laser stimulation to keep the cells activated. And we'll have you come back for your 3 months follow-up and do another scan. Oh, by the way, here's our inflammation scans. So this is infrared thermography. This is a month ago. So red is normal temperature, 98.6. It's a good indication of normal blood flow. And then this is white, or it's light blue. It's actually hotter on a temperature scale. All this inflammation in her knee. You can see 1 month later, especially the outside border, you see how the inflammation is starting to retreat back, and that's only after 1 month. So yeah. And then you can see her neck from C1 all the way down to C7, all inflamed. The white, it should be red. You can see it's getting more red here, especially the upper neck, less inflammation. And yeah, so it's coordinating with their, it's fun how the scans, they're coordinating with the results, okay? So we'll get you laser today. We'll have it back in a couple months just to make sure it's lasting. Congratulations.
thank you.